We'll talk about I have no financial interests, a 13-year-old Caucasian male brought in to rule out a possible retinal and or macular dystrophy, 3-month history of non-progressive visual impairment, no pain, no trauma. Had been examined at an outside clinic about 6 months earlier, and the report was a normal macula and retinal examination. History of ADHD, depression, etc., medications as listed, and I put down the indication for medication since these are medications we don't always encounter in our ophthalmic practices. Of significance, this young gentleman attempted suicide with antidepressant medication about 2 months earlier as well. Vision was now 20/50 and 20/60. Anterior segments are quiet. Vitreous cavities are quiet. There's no cellular flare. And you see the posterior poles here both show some pigmentary deposits and a little bit of pigment atrophy centered in the macular regions bilaterally. Red-free highlights those changes, but I think you'll see here angiographically, now we have the areas of blocked fluorescence along with mottled hyperfluorescence, right eye, left eye, a couple little streaks there as well. And so the question arises, here's the OCT showing some vertical areas of abnormality, but quite good preservation of the foveal contours and just matching up some images here. So we have a young gentleman who attempted suicide. He's been on an array of medications sent in for a possible macular dystrophy. Laser. I didn't mention laser, Rich. What are you talking about laser?
I think he might have been staring into a highly powered Chinese-produced internet bot.
You're going to cause some international problems here, Rich, if you start.
Yeah, it's true.